Hi, so today I'm just going to perform how to give insulin subcutaneously to my patients. So in order to give any type of medications, it's very important to follow the institute policies such as identify the client and using the standard precautions as well as doing our 6 right and 3 checks. So I'm going to start doing with my first check. So in our first checks, what I'm basically doing is like compare my medications on MAR with the medication dispensing system. So I have my medications order in my laptop screen where it says NPH insulins 12 units subcutaneous daily, and let's see what I have in my dispensing system. So NPH, yep, I had the right medications. It says 100 units per ml. I'm just going to show you, but I don't know why mine is in yellow. Okay. um so I did my first check. So right after my first checks, before move to the second check, I have to select my needles and syringes, but it's based on the volume, medications type, and adipose tissue mass of the patients and injection site. But in my case, I'm giving only 12 units, and I'm going to use this 50-unit syringe to my patients. So once I done with my first checks, my second check will be prepare the medications and again verify the right client, right medications, right dose, right route, right time, right documentations, allergies, and any expiration date. So I'm going to do that again. So in my order where it says NPH insulins 12 units subcutaneous daily, in my now I can actually pull the medications. So I still have the NPH 100 units per ml, but let me see when this will going to be expire. So this will going to be expire on 2023. So I'm good with the expiration date. Okay, so I pull my medications up now. Once I pull my medications up, I mean, I in second check I can either wear the gloves or I mean, if I can wear, I can either wear or not. So it really doesn't matter. But if I have to inject the patient, then yes, I do have to wear the gloves. So once I pull up the medications, I am going to um, roll this file gently. I'm not shaking the insulin, so I'm rolling it for like a couple seconds here. Okay, and I rolled this. Okay, let me put it back, and then I'm gonna have to wipe the top of the vial here. For 15 seconds in circular motion and let it air dry. Okay, so I did wipe my vials. Now next, as I said, I'm going to use this 50-unit syringe. So I'm going to pull that up. Well, I'm going to take that up from the packet here. Okay, so okay, so in order to pull, like, withdraw the medications from the vial, first I have to like draw the air up to the same level of the medications. So mine says 12 units, so I'm going to pull this cap, and the what they call the checklist, it says like pull up, but I don't think it really matter if I pull up or down. So to me, I feel like pulling down is like a little comfortable, so I'm just going to pull down here, and make sure this cap has to stay upside down. Okay, and the important thing, like when we are dealing with any type of syringe, it's very important that we're not touching inside this plugner, because that's what considered as the sterile, and we're always like holding in the middle of the syringe right there. So I'm going to pull draw 12 units of air. 10, 11 and 12. Hold on. Okay, so it's right about in the 12 units. Okay, now, so once I draw with my air, I'm gonna have to like direct put this needles like into in the vial, like air to air. So I'm going to hold that, and then again I'm going to hold it in the middle here. Okay, so insert it here and then push it back ear to ear, and then I can draw my medications up to 12 units. I might gonna draw a little, not a lot, but just a little bit more than 12, so that if I have like a lot of bubbles, I can prime that little bit once I done withdrawing the medications. So I'm going to draw up to 12 units here. Oh, okay, I can get like 12. And again, when I like pulling the medications, make sure I don't have any air bubbles. Okay, let me pull that up. There we go. Okay, so I have not any airs. I have the right amount of 12, like right volume, 12 units. Just going to show you here if you can see. Okay, so once I done pulling the, withdraw the medications in my syringe, so I'm using my dominated hand to recap it again. Hold on, let me put up there so you can see. Okay. There we go. Okay, so I did use my hand, but like I know I'm not supposed to use the hand, but I just moved that cap from the place that you can see to the proper one. So I kept my syringe. So I would like to put this syringe back to my this packet where I open it. So because I kind of pulled this plunger way too far, so I don't want to contaminate this plunger. So I'm just going to put it back up there. Okay, all right, so I'm done with my second check. So my third check will gonna be at the bedside. So again, I will identify my patients with two identifications with their name and date of birth and the bracelet, and also verify the 6 rights. So right client, right medications, right dose, right route, right time, documentations, allergies, and expiration date. Again, so I will still carry this bottle inside the room, so that way I know what medications I pull up, and that way patients can also feel safe like what they are getting. So again, I did my third check. So I already pull up the 12 units in here. So this is my bottle. From this bottle I pull up. So once I done with my 3 check, I'm going to wash my hand. I'm going to provide the privacy, use my body mechanisms, and safety. And then after that, I will use the gloves. I will don the gloves, and then I will position my client, and then I will find the right side, like the proper sites for inject. So for insulin, so we can always inject in the outer part of the thigh, abdomen, but it has to be 2 inches away from the umbiliculosis, and like the back of the arms. And also we can do in the love handle, but like maybe only few people, few patients can do that, but most of them they go for the arm or in the belly, so either one. So once I find my site, I will use my alcohol swab to clean that. So let's say this is my site here for right now. Okay, you can see that problem. Okay, so I'm going to clean that for 15 seconds with circular motion again. There you go, and let it dry, let it air dry. So once it dry, so I'm gonna have to kind of know that like which angle I'm giving the injections. So it's depend on the patient size, as I already said that. So for the fragile, if my patient is really fragile and thin, I'm only go, and if I can only able to pinch up to like less than 1 inch, I can go up to 45 degree. But if I can able to pinch more than like greater than 1 inch, I can go to the 90 degree. And if I can able to pinch like greater than 2 inch, I can still go to 90 degree, but I have to spread and tart. So I'm just going to do the one with the 90 degree, like which is greater than 1 inch, and then I'm gonna sew. Once I done with the medications, I'm gonna sew how like the angle. So by now my this side is dry, so I'm going to tell my patients that I'm giving the insulin. So I'll take this from here, and so I will uncap again. I will uncap this here. I'll uncap this. Okay, I'll uncap. Now I'm going to use my non-dominated hand to pinch here, and then I'll go like straight down up to the 90 degree. So boom, and then once I go there, I'll inject slowly and then put it up in the same way. Okay, all right, so once I'm done with that, I will immediately engage these needles and throw it in the sharp container. But before doing that, I'm just going to show you how am I gonna do the 45 degree and the spread and top. So once I done with my this 90 degree, once I done with injecting my patients, I'm going to pad, like gently pat it. I'm not going to use the alcohol swab, but I'm going to use the gauze. So I pat it. So let's say if I have to do with the 45-degree angles, I'm not going to put the insulins, but I'm just going to pull the air and show how to do that. So for 45 angles, I'm just going to pull the air and so how am I going to do the 45-degree angles. So let's say I'm again pulling up to the 12 units. So 10, 11, and 12 units. Okay, so I have 12. So if I have to go to the 45 angles, 45-degree angles, I have to go like this and make sure this needles is like not going towards the what they call the towards the finger. It has to go like along with the fingers. So like this and slowly engage that and then pull it back in the same way. That's my 45-degree. And again, make sure that you engage them and throw in the sharp container. And for if I pinch greater than 2 inch, which I have to do the spread and taut. So again, I'm just going to pull the air. I'm going to pull the air 12 units up to, there you go. And then for that passage, I'm still going to do up to the 90-degree angle. So I'm gonna have to spread and taut here, and then go like directly like that straight down to the 90-degree here. So boom, slowly engage, put it back, and then engage your noodles and throw to this sharp container, put it back, and then after that you can again pat it gently with the gauze and wash your hand. Make sure your client is comfortable and document your medications that you're given in the MAR. And that is pretty much for the subcute.